we are going to talk about is called as Vildagliptin. But before we get into Vildagliptin, quickly let's see as to what are the different types of diabetes mellitus. There are two basic types. There are also other types, but today we'll talk about one type of diabetes, that is the type 2 diabetes. The type 1 diabetes is what is called as insulin dependent diabetes mellitus, where the patient has to be given only insulin. Other drugs, oral drugs, are not effective in treating these patients. This is less common. It is also seen in children as well. Type 2 diabetes is more common. It is seen in a large number of patients, large number of population. It is called non-insulin diabetes mellitus. That means insulin may not be the only treatment that is available. Insulin can also be used, but as a last resort. There are multiple drugs or oral medications that are available, tablets available, which can effectively and safely control these elevated high sugar levels in patients of diabetes mellitus. There are other types which can be seen. One is called as gestational diabetes, and as the name suggests, it occurs in those women who get pregnant. So it is diabetes that occurs during pregnancy. That's why it is called as gestational diabetes. There is also a condition called as congenital diabetes, where the child is born with diabetes. Maybe one of the parent or somebody in the family is pregnant, and it gets passed down through the genes, through the chromosomes, and then the child develops diabetes. So today we are going to talk about a drug, as we said, a new drug which is called as Vildagliptin. So this drug belongs to a group of drugs known as gliptins. Now, what do these gliptins do, and how do they act? So these drugs primarily act around the GLP, if you remember, around the mechanism that involves the stomach, where it releases GLP and then it stimulates the pancreas to release more insulin. So now we are going to talk about the treatment of diabetes. Now, as we said, the diabetes is a multifactorial disease. It presents to the physician multiple steps which can be addressed so that diabetes can be treated effectively depending upon the patient's age, weight, lifestyle, hereditary factors, etc., whether the patient also has other conditions like the kidney disease or heart disease, etc. So among the many drugs available, there is an important class of drugs which has come up recently, and these drugs are called as gliptins. An important aspect about these drugs is that these agents are shown to control both the fasting and the postprandial. Fasting is, for example, if I can explain that whenever your physician advises a blood test to test about the sugar levels in the body, he says do your fasting and postprandial or post meal. The fasting is when the technician takes your blood before you have eaten anything in the morning, and then you have your meal, and then he or she tells you to come back, or maybe as in nowadays we have home service, then they'll come at a particular time to take your blood to test for the postprandial or post-meal blood sugar level. So it's very important to see both the aspects, because we have to see how the body responds when it is fasting, and when the body responds when we eat a meal where the sugar levels take a hike. So it's very important to see both the aspects so that the physician knows how the body is responding to these meals, and then he or she will decide which drug is best for you. Now, talking about these gliptins, these drugs are safe to use, and a very important factor is that unlike some other drugs, they do not affect the patient's weight. There are some drugs which can lead to weight gain when you are taking the medicines for diabetes, or there could be some amount of weight loss. But these drugs are called as weight neutral agent. That means they will not affect your weight if you take these medications. Another important aspect that would come to your mind is that if you are taking a medicine to reduce the blood sugar levels, your sugar levels can go down, which can lead to sometimes symptoms like dizziness and weakness and lethargy, etc., headaches. Why? Because these agents will cause drastic fall in the blood sugar level. This also is minimal in this particular agents.